important thing. You want to do something that is important. You are dealing with over-the-counter medication. Yes, we were dealing with counter medication, and want to talk about prescription medication. We want to talk about prescription medication. So, welcome. Today is on Wednesday. It's a good time again on Wednesday, and the week is rolling, and we want to go on with whatever that we are doing. They're coming in. Welcome to the chat. Big up every time. Who is that? Let me check this one. Yes. Let's continue with the topic. Let's continue with the topic. What is prescription? Greetings, I'm here again. Oh, that is Boss. Boss, how are you doing? I can see you're here again. Just a minute. I take care of something here. Let's continue. Prescription medicine are medicine that can legally be supplied. Reha is here. Like to go. Reha, welcome. How are you? I'm fine. We are talking about prescription medicine. I came back and let's talk about prescription medicine. Prescription medicine can legally be supplied or used only when prescribed or authorized by a qualified health professional. These are not medicine that you can just give out. These are not medicine that you can just give out. They have to be prescribed by Boss saying Yes. So let's continue. They are generally used for conditions that require proper diagnosis, monitoring, and also individualized dosing. So if you are coming in right now, we have several issues we want to talk. Welcome to the chat. If you have any question, just ask the question and let's interact. Let's get to interact. As everyone is coming in, the topic of today is prescription medicine. Yes, I can see I'm connecting some issues. So Reha is in the house saying hi, boss. Boss Reha, I'm doing good. What about you? Reha, boss is my friend. Connect with boss one. You can connect with Bosire. So prescription medicine are medicine that can legally be supplied or used only when prescribed or authorized by a qualified health professional. They are generally used for conditions that require proper diagnosis. You just don't give drugs, you see. You just don't give drugs. Yeah? You have to have proper diagnosis. Proper diagnosis. You know, I'm good. As you come in, you are a new person to this channel. Yes, that one I'll talk to that one at that time. If you're coming in right now, just hit the like button. If you have a question, ask the question. Ask the question, and we continue. Prescription medication is very important to avoid treating the wrong disease or condition. That is very true. It is very important to avoid treating some diseases that are not in prescription medicine. We have said, let me repeat about it, are medicines that are legally supplied or used only when prescribed or authorized by a qualified What are you famous in medical field? I'm famous in heart issues and autoimmune issues, authorized by a qualified personnel. They are generally used for conditions that require proper diagnosis, monitoring on individualized dosing. You get? So you just don't go over the counter and you ask, I want this kind of drug. And we are going to see which kind of drugs are prescription medicine. We will go and see, and let's go through them, because some people don't know. Heart, okay, friend, yes, heart. Some Jamaican uncle is in the house. Welcome, Jamaican uncle. Some people don't know what are prescription medicine, and even some medicines that are prescription medicine, they have been abused and they have been sold randomly, just randomly over the counter without even taking care of the need. You see, they need to know their prescription medicine, making people addicted, making people be. Sometimes, some things are very bad. You see, not taking care of people who suffer the resistance. Okay, let's get to see the types of prescription medication. We have, if you are coming in, you are a new guy in this platform, please hit the like button, and also what you can do is like the channel, talk to the people that are in this platform. Now we have several types of prescription medicine, and they are antibiotics, more like amoxicillin, and azithromycin. I know most of you go and buy these drugs over the counter, man. It's not illegal. It is bad. It is bad. Antihypertensives. Amlodipine, lisinopril, all antihypertensives unless you have a prescription. Today we are going slow because people don't know. People don't know over-the-counter medication and prescription medication. They think all medication is medication. Yes, antibiotics. Amoxicillin is not over-the-counter. I know some people here are used to amoxicillin over-the-counter. Antihypertensives. Antihypertensives. The one that you usually like that is called nifedipine. Always over the counter. Welcome everyone. If Michael N, blessed day my people. Michael N, yes, I want to tell you something, Michael N. Thank you so much for supporting everyone. I know you are not a YouTuber, but your support to everyone see, your support to everyone, your support to this. Hi Jamaican, I'm second. I am the second wise man. You have been supporting everyone since Marwa's channel, coming to our channels, just watching, give support to everyone. Give support to everyone. Just coming to watch. So Michael and Jamaican uncle, be blessed. Continue supporting everyone. Continue supporting everyone because you see, continue supporting everyone. It's a good thing. And right now that the rules and regulations of YouTube are changing, time's gonna be hard, my friend. Imagine from 4,000 watch hours to 8,000 watch hours, and how it was hard to get 4,000. Now you will need, even if you are monetized, even if you are monetized, you will need to have at least 1,000 to 2,000 watch hours in 365 days. My colleague, thank you so much for that. See, I'm taking water. I say and I say it again. Everyone who is so I was saying that if I think you are the second one, it's gonna be hard, my friend. It's gonna be hard, my friend, because supporting someone to get 8K watch hours is, keep it up, Dr. Ben. Yes, thank you so much. Thank you so much for it. And you know, there are some things that as I come online, I want to tell people one thing, and I want to everyone that will listen to take this in the back. Dr. Benjamin has businesses. Dr. Benjamin is employed. Dr. Benjamin is online. Why I come online is because I want to sensitize people and bring back together when will the new rule of 8K taking place next year from January. You see, so I want to come and sensitize the people, and this is not my primary source of income, but there is someone who has the primary source of income is YouTube. The way you interact with people, be careful. You get it? The way you bring people together, be careful, because you may lose the people that you may lose people that may promote you. So everyone who is supporting everyone online, thank you so much. You are doing a great deal, because it's a source of income to some people, and it's bringing food to the table to some people. You get it? Yeah. For young YouTubers that are upcoming, and you want this to be your source of income, know how you interact with people, know how you interact with negativities, know how you interact with positivities. Maje is in the house. Big up every time. I can see Michael. When will the new rule of 8K take place? The new rule will take place from January. So it is very important from now. Young YouTubers will struggle. Very true. It is very important if you want this to be a source of income. From now, you start working hard. Be creative. If you have a channel, be creative. Start doing creative videos that will attract people. Talk to people in a nice way. Don't be confused. You see, here on YouTube, there are two categories of people. One, a person who is employed, and this is just a part-time thing, and there is that person that relies on YouTube to get something. So don't get mental challenges because you are not doing good. Ask yourself, what is that you are not doing that is not making people be open. I usually tell people, if you want we talk about this, let's talk about that, but I'm running YouTube for only hobby. Sago. Friend. Sago means friend. So if you see an Indian telling me Sago, just know it's a friend. So big up Ajay, big up Michael Len. May you be blessed for what you've done. You with Jamaican uncle, you have always assisted people directly from your pocket. Yeah, I've seen what you have done in the villages. I've seen what Jamaican uncle has done. I've seen. Don't get mentally depressed because your channel is not doing good and someone is at ease. Don't feel bad. Be creative. Do something to your channel, especially when it is your primary source of income. If YouTube is your primary source of income, be careful. You get me right? Be careful. You may get mental challenges. And you have seen in some villages out there, people are fighting, people are bringing issues, people want to, it is not because these people are bad. No. Today's topic is prescription medicine, but let me talk about this first before we continue. It is because this is the primary hope of someone. This is the primary hope of someone. But someone else is doing better than this person, and then this person takes it personal. And when he takes this thing personal, you start midweek greetings to you, wise guy. Big up to you, Sans Kitchen. You start shenanigans. Yeah? You forget the other person who is doing well. Maybe the person has endorsements, the person has other source of income. And you, instead of talking well to people, coming to people, knowing how they can assist you, start becoming. So let's just live. Let's tell God to help us. You see, times are getting tough. Even when YouTube is increasing their watch scale, and also to the ones that are monetized, they are being told, if you're not making 1,000 watch hour, if you are not making 1,000 watch hours, we will unsubscribe you from monetization. We need a medical session on mental challenges affecting YouTubers, psychology issues. Yes, I think I'll do that. We will host Jamaican uncle. I think we will host with you a tagged session on this, and I think we will talk. I'll talk to Jamaican uncle. We have a tagged session where we will be talking about where we will be talking about something about singing to you, my brother Michael. How? Yeah, about this mental. Most people, let me tell you one thing. You go to the village, you find a young guy has been doing all jobs, like going to plant, helping people in the farmlands, so that this person can get something to eat. And when you get it, or when you get it, you are introduced to this platform, you start getting something. You want to be bigger tomorrow, not even, you don't want the gradual rise, you want to be bigger immediately. What does that say? It says that you have a problem mentally. Benjamin, we're gonna do this Sunday coming. Yes, we're gonna do it this Sunday coming, and it's gonna be, we're gonna host it too with the Jamaican uncle, and we're gonna talk to people about this, because I've seen mental challenges of coming out of this YouTube thing, and now that YouTube has raised the bar, more challenges will come out. You'll come out. What? Yeah. They should be doing consistent creative, that people watch videos. Yes, MaJB, I've always talked to people about being creative. I've always talked to people about, when you have a content, do your content, do you, but be creative with your content. Yeah? There are some things that people do, like you want to put a camera just to faceless cameras, you understand? And you want to earn from them. People that are big YouTubers out here, let me name like Mr. Bean, our friend Marwa, D. Mwango, let me name someone. There is Herald Badr. There is a guy called Herald Badr. Those people that I see, they never sit down. They never sit down. They always up and down to create a new video that is people will watch. So let's get on about mental challenges. Let's get on the prescription medicine. On Sunday, be there, invite someone. We're gonna be talking about mental health and challenges of YouTubers when it comes to monetization. Pancha Nathan, hey, Jamaican uncle. Now you meet Pancha, Jack Sparrow, Benjamin, all my friends from India. Pancha Nathan is in the house, Jack Sparrow. Now, Jamaican uncle, Pancha is here. Thumbs up, Benjamin. Pancha Nathan, a good one. You meet Jamaican uncle today. Jamaican uncle Pancha Nathan is a leader of a crew somewhere. Hey, when they raid your inbox, you are live. You Pancha, like my son. Yeah, you're like big up to you, Pancha Nathan. Jamaican uncle, I want you to follow Pancha Nathan, a very good friend of mine and a very good supportive member of Indian community. Jack Sparrow also, not forgetting Reha. No, Pancha. Follow Jamaican uncle. You guys can do a very great job. I was in your channel and it was great, right? Now, hey, my friends, all of my friends are here. Someone is telling me, hey, the dog today is speaking in a harsh tone. No, I'm not speaking in a harsh tone. I'm telling people the reality. The reality of life. The realities of life. Mental health is a complicated thing, and it's a thing that can mess you up. It's a thing that can mess you up when you get to some things that you don't know how to maneuver them. So welcome everyone. If you are here and you have not hit the like, the teacher, you have not hit the like button, give it. Dr. Ben is not playing around today. Yes, Michael, I'm not playing around, because I've noticed many people are undergoing mental traumas because of online community. They don't know how to balance the pressure that is online. You are a new YouTuber and you don't know how to balance the mental pressure that is here. You look at your friends' stream, it's doing good, and then you start having negativities. No, we don't need that. Yesterday, Pancho Sago live stream on I Know You, Benjamin. Yes, yes, Reha. I was in Pancho's live stream. Benjamin, lots of love from India. Good one. Tell them I'll be in India very soon. I'll be in India very soon. I'm good, Stella dear. Oh, when you hear Jack Sparrow saying Stella, Jack Sparrow means Stan's Kitchen. we don't have a Stella in the chat. So if you see Jack Sparrow saying Jack Sparrow saying Stella, just know is meaning Stan's Kitchen. Stan's Kitchen was given the name Stella by Jack Sparrow. The B teacher. Thank you, Stan. Thank you, everyone. Now, there are some things that you should know. I saw your live stream with Pancha. Big one, boss one. Yeah. You see, I have told them that Dr. Yeah, man. Sometimes you have to discuss this topic, Benjamin the Wise Guy. And I think it is very important, Jamaican uncle, because most of the people that we have, and even if you look at the chat right now, 3/4 of the chat right now is of YouTubers. Most of them are YouTubers and are supporting me. Now, let me put this topic of today aside first. When a person comes in the chat and sees your chat is doing good, the next time the person will go to his or her live and people are not supporting him or her, this person will start having hatred or will start having mental problems. Start asking herself for himself that people don't like me. Why am I not getting? You know. Welcome. Let's continue. Let's continue. Yes, let's continue about this topic. It's a very important topic and you need to check it out. So here we have several things that we are looking at. Prescription medication. Prescription medication are medicines that can legally be supplied or only be prescribed or authorized by a qualified health practitioner or professional. They are generally used for conditions that require prescription medicine are generally used for conditions that require proper diagnosis, monitoring, or individualized dosing. You see, the teacher, Panthanatha, Stan's Kitchen, everyone who is coming in the chat, big up yourself. Thank you so much for coming in. And big up every time. Check if you don't know someone, just say, we will introduce you to that person. So the examples of medicines of prescription are antibiotics like amoxicillin, azithromycin. We have several types of antibiotics, and these several types of antibiotics are considered as let's say the cephalosporin, we have fluoroquinolones, we have penicillins, and even the cephalosporins, we have first generation, second generation, and they treat different. So you have to be prescribed precisely to know what it is treating. Antihypertensives, amlodipine, lisinopril. Anticoagulants like warfarin, apixaban. Those are drugs that need proper diagnosis. We have antidepressants. You don't just take antidepressants because they are antidepressants. No, you will need a prescription for you to get that from a qualified. If you go to a pharmacy and then you tell them, I think I have depression, give me antidepressants. You will not be given. You will be told, go to a specialist, let the specialist give you the prescription, and then we will give you. I'm doing better today, teacher. I've been very busy lately, summer activities. Yes, Stan's Kitchen has been so busy lately, I've noticed it. So let's get to check anti-epileptics. Those are kind of examples. Strong pain medicine like morphine. Morphine you can never be given over the counter, and some of the opioids you can never. Corticosteroids like prednisolone. And you see, nowadays people sell prednisolone over the counter. People sell prednisolone over the counter, and it is a problem. Steroids over the counter is a problem, but if you go over the counter, you'll get them. Hormonal medicine like levothyroxine and certain contraceptives like Femiplan that are sold 3 months like Depo-Provera, those ones are prescription medicine. You can never get them over the counter. You can never get them over the counter. And why do they require a prescription? Someone may ask, we have just started about prescription medicine before we go in deep. This is something overview. Uncle, I hope you have met Pancha Nathan, and I want you to check Pancha Pancha's Pancha is doing a good job. Very good job from India. Big man, I say, from India. His channel is big, and he's doing a good job. So, Uncle, please. So, why do you require a prescription for this? Why do you require a prescription for this? They may have serious side effects. These antibiotics can get resistance. Antihypertensives can bring low blood pressure, and you can go. The correct medicine depends on the patient's diagnosis. The doctor has done investigations, and the doctor has brought out a diagnosis that requires that specific medication. And that's why they are called prescription medicine. The dose may need to be calculated according to age, weight, kidney, or liver function. You understand? I've not said according to age alone. I've said according to age, weight, kidney, and liver function. And that's where we come in and say there is something I talked about: metabolism, pharmacokinetic and dynamism, bioavailability of the drug, and excretion, how it is removed. And that's why we see kidney and liver there. The drug is metabolized in the kidney and excreted in the liver and excreted in the kidney. It's removed from the body in the kidney. So you guys, I will have to do when my device is not okay. No worries. So you see, these drugs, they can injure your kidney, they can injure your liver, but at the right dosage, they will not. And this is what the doctors look at. You check this out. This is what the doctors look out. So my friends, some can cause dependence issues, and we don't want to depend on drugs. So the doctor knows the right dosage so that you cannot get dependence. Some require laboratory tests or regular monitoring, like this drug. Sorry for disturbing. Some work. I leave now. Okay, bye. Take care. Now, okay, it's okay, Reha. No worries. There is these drugs that are anticoagulants. You have to go and do the INR to check if the blood is okay, so that you cannot have problems of doing what? Bleeding, even in the gaps, always. Certain medicine are unsafe during pregnancy or breastfeeding. They are called teratogenic when you are pregnant. They can, hey, are you a drug man? I am a doctor. Isaac, I am a doctor. Welcome to the chat. We are talking about prescription medicine. We are talking about prescription medicine. Where is my friend? This friend of mine who is called here Jack Sparrow. Jack Sparrow, where are you chilling at? You have gone. Punches are go by Benjamin Fred. Okay, prescription medicine helps ensure that potential high-risk patients are used appropriately. A person is immunity is down. This person is struggling from some things is struggling from, let me say, is struggling from a disease that is liver disease, and then you are giving highly potent drugs with the wrong dose. You are helping this person to die early, because as the liver is suffering, you are adding more drugs. This person will die earlier. Safe use of prescription medicine. Safe use of prescription medicine. Take the medicine exactly as prescribed. You see, but let me repeat again. Why do they require a prescription? Why do people require a prescription? They may have serious side effects. You know, the correct medicine depends on the patient's diagnosis. Do you have malaria? Is it proved you have malaria? You need anti-malarial. Is it pneumonia? Is it a bacterial pneumonia? You need an antibiotic of specific type according to the strain that is you are suffering from. The dose may need to be calculated according to your age, weight, kidney, or liver function. You just don't take drugs because you see a doctor saying give 500 milligrams twice a day for these days. You don't just do that. You have a specific dosage that you are giving according to age, weight, so that you can preserve the liver and the kidney. They may interact with other medicine, so the doctor needs to know which other kind of medicine, long-term or short-term, that you are taking, so that you cannot have drug interaction. Some can cause dependence and misuse. Yes, there are some drugs like syrups that have containing codeine. They may bring dependence. Some require laboratory tests or regular monitoring, like anticoagulants like aspirin, clopidogrel, and the other ones which are called hormonal drugs like levothyroxine, menotropin. Those are drugs that they need to be monitored. You see, they need to be monitored. Certain medicines are unsafe during pregnancy. You cannot give metronidazole on pregnancy at the first trimester. You see, it is teratogenic. It can destroy the growing baby. The products of conception will be destroyed. So when you are pregnant, you need to talk to your doctor, tell your doctor that, hey, you know I'm pregnant. Don't give me a drug that will bring mayhem. Some medicine require gradual dose reduction rather than sudden stopping. Mostly these are antipsychotics and also hypertensive drugs, diabetic drugs, and also what? Antidepressants. Yes. Prescription medicine help ensure that potential high-risk treatment are used appropriately. Potential high-risk treatment are used appropriately. Now, let's talk about, I want to go through the examples again. Benjamin, me on travel, sorry. Oh, okay, you are going home or at work. Pancha is traveling. There is a sign of a tuk-tuk there. Okay, examples. Let me go back to examples of antibiotics. Of prescription medicine. One, antibiotics. Every kind of antibiotic. I heard some people saying that I just need a mild antibiotic or a strong antibiotic. There is never a mild or a strong antibiotic. Yes, thank you, Pancha. What you need is an antibiotic that is going to work well with the problem that you have. Hello, Benjamin and everyone here watching on TV and sewing. Oh, nice, nice, nice. Thank you. An antibiotic that you will use according to the problem that you have. You see, people say amoxicillin is a mild antibiotic. It's not. It's a penicillin, and when it is used for the right cause, it can work very well. So from today, if you are watching, don't say that I need a strong antibiotic. So no, always say I need a better antibiotic for the problem that I have. Strong may destroy you. Antihypertensives like amlodipine and lisinopril. We have antihypertensives, then they have classes, and everyone who has high blood pressure, they don't have the same high blood pressure because it depends. We have A, B, C, D. A, B, C, D. It stands for let me see. Yes, let's talk on how these categories as we go. ACE inhibitors like angiotensin converting enzyme inhibitor. That is the first class of anti, like losartan. If you are using losartan, just know we talked about this thing. Beta blockers like atenolol, bisoprol, metoprol, and carvedilol. You see, carvedilol, beta blockers. C, calcium channel blockers like nifedipine, amlodipine, diltiazem, and verapamil. You see, and then we have diuretics like furosemide, indapamide, hydrochlorothiazide. You see, they are for different things. There is someone who needs an antidiuretic like furosemide, but there is someone who have, when you use calcium channel blockers, because the hypertension is different, it becomes so well. So antidepressant is another class of prescription medicine. Corticosteroids like prednisolone, hormonal like levothyroxine, and contraceptives. And we have said why they require prescription. Why they require prescription is because they have serious side effects. The correct medicine depends on the diagnosis. The dose may need to be calculated according to age, weight, liver function, kidney function. You don't just give drugs. These drugs you don't just give. You see, people think we just give drugs. They may interact with other medicines. Some can cause dependence and misuse. Some require laboratory tests or regular monitoring. Incorrect use of these drugs may bring problems, may be worse than how you are. Certainly unsafe during pregnancy, that we have talked about. You have seen some people that have gone to some facilities of treatment, to get treatment, like health centers, outpatient facilities, and then you get there worse than you went there. You get to a facility, you come on worse than you went there. Why? Because the medications that you are given, the medicine that you are given are not good. It escalated the disease that you had. it escalated the disease that you had. Prescription medicine, not a one man. You have to get the proper diagnosis. And when I talked about antibiotics, if you get the wrong antibiotic for the wrong cause, you will get resistance. My friend, if you get resistance of antibiotics, treatment will become so expensive. I was asking someone one day, imagine a person getting resistance of anti-TBs. Yeah? Ravi saying I'm the 13th and I've liked it. Ravi, big up yourself. Thank you for coming on. Yeah? Super life. Big up yourself, Ravi. Imagine you getting resistance of anti-TBs. Which other drug will you treat TB with? Tell me, my guys. Tell me, if you get resistance of someone gets, because you are given the wrong medicine and you have given anti-TBs and you're taking them wrongly, how can you treat now? Tell me, my friends. So these are things that are very serious, and never just get on to get antibiotics over the counter. I know some people get over the counter antibiotics, but these antibiotics are clustered within specific groups that the bacteria that they are treating, there is a bacteria that is broad spectrum. There is a bacteria that is not broad spectrum. There is bacteria that use aerobic, they use oxygen. There are bacteria that don't use oxygen to survive. They live in blood without oxygen. There are specific antibiotics for all these bacteria, and that's why you will see we have several types of antibiotics, and we use them accordingly. We don't just you have come, you are coughing. You are coughing a lot. Yes, doctor. A lot. Yes, doctor. I want you to give me the strongest antibiotic, and the doctor looks at you and gives you no, that way. No. And then you go home and you say, someone told me that, doc, I was given the strongest antibiotic, which is augmentin, and I felt a little bit better, but I didn't feel good. I still have problems, man. You see, so these are things that you should be putting in consideration, things that you should be putting online. When you have been given the strongest antibiotic and you say it was the strongest, because people say augmentin is the strongest of all antibiotics. And then after some 7 days you start having a problem. Very important you take regards of this. I said, if you are a man, and you are always using steroids to treat flu, you have a problem. Go back to that video. If you are a man and you are always using steroids to treat flu, if you are a man and you think you need a steroid, go consult a doctor. We don't want problems when it comes to, you treat a flu with a steroid, alafu, I'm even speaking in Swahili right now, and then after some time, you start treating a bad condition rather than that mere condition that you had. You get me, guys? This is now the topic. Whatever we are talking right now is the topic. This is where now we need to listen. We need to follow, because prescription drugs are very important. Prescription drugs are drugs. Let me repeat here. I know you are listening and feeling nice. Feel nice as you listen and get the information. Prescription medication are medicine that can legally be supplied or used only when prescribed by an authorized personnel, healthcare professional, and a qualified personnel. Qualified and authorized are different things. Qualified prescriber is a doctor or a medical practitioner licensed to write it down. Qualified distributor is a person who is given the license to give it to the patient. You see, they are generally used, listen my friends, listen to this, they are generally used for conditions that require proper, where I'm saying proper, I'm not saying a diagnosis that was given by a quack, a diagnosis that was given by your friend who works in a hospital and is a mopper, who mops there and cleans and knows some drugs. You understand that? You understand that? Yeah? Yeah, Nadini, big up yourself for coming here. Big up, thank you for tuning in. A qualified, proper person who gives the proper diagnosis is a person who is licensed to do that. Monitoring or individualized dosing. Is someone feeling me about these drugs, man? Are you feeling me? If you're feeling the doctor, tell me yes, we are getting it. Yeah? Today the doctor is talking authoritatively. Today I'm talking authoritatively, man. Hey, it is because this topic is very important. Some drugs that have been offered to patients have escalated the problem that patients had. Some drugs that have been offered to patients have made those patients to be sick. Some drugs that have been offered to patients wrongly have made those patients to die earlier than their age. Yeah. I'm India, all of you my channel inviter. Big up Nadini, big up. So you check me out, my friends. Yeah? And now I'm saying, amen, men with steroids, stop them. Yeah. Antibiotics, antihypertensives, I've named them. Angiotensin converting enzyme inhibitor. Those are people that have problems with the kidney, releasing the renin, and then you have high blood pressure. Yeah? Calcium channel blockers, problems with the veins, and your veins have problems in relaxing and constriction. That is how we check how to give these calcium channel blockers, diuretics, furosemide, fluid overload causing high blood pressure. We give you diuretics like furosemide, osmotic diuretics like what? Mannitol, and then we give you potassium sparing like a spironolactone. You get? That is how we know how to give these things. Yeah. You don't just get someone who is in a white coat who does work somewhere and he knows a few drugs. A person who has Googled and think that I know much about medicine. Please, Googling is not going to study and getting licensed. Yes, you check me on that. Googling and reading some medical books is not being licensed. Well, you know, there some people, Miriam, Mirchi Mata is here, my friends. Big up Mirchi. Googling and reading some few medicine books and you think you are better in these things is not being qualified. Yeah, smile in the city, in the house, big up every tribe. Those people that work in the hospital and different departments, starting from the doctors, the health records department, the lab technologies, they have gone on years of study. Some of them have failed exams, have repeated the exams. Some of them have read overnight. They have to study the concept. And you with Googling, you with Googling and getting some few concepts, you want to tell the doctor you know more. You know, you, my friends, are you feeling the doctor today? This is a topic that I will not rush. This is a topic that, this one is a topic that makes the client plus the doctor, or the client plus the quack, not to go hand in hand. Why? Because the quack gives you, you know, you trust your quack. And let me call them the quacks. Because if you are prescribing medicine and you are not qualified, you are a quack, even if you work in a hospital. Check check, it's very important to check very important things like the professional practice standards. If you are a nurse, do what a nurse should do. If you are a doctor, do the specific part that you are told to do. If you are a consultant, you know what to do. If you are a health record person, you know what to do. Always consult the higher level or the next person if it is not your field. My people, are you feeling me? Are you feeling the doctor today? Yeah? So if you are coming in today, this is Dr. Ben. Dr. Benjamin is the guy that you are watching and feeling. And we are talking about prescription medicine. Why are you quiet, my people? Talk something. Or today I'm talking in a harsh tone. Come on, my friends. You are my friends. We are sensitizing each other. Tell me something, boy. Tell me something. Imagine you are a doctor and then a patient comes and tells you, you know, when I use this amoxicillin, that is the right medicine, and you know this person has a problem in the stomach, and if I give amoxicillin, this person will diarrhea to death. So what do you do to this person? Because the quack at home, the person who works at a particular hospital or a nurse, has told this person amoxicillin is the best, but you are the doctor now. What do you do? What do you do, my people? Tell me in this situation. We go through many things and we say God is good all the time in these hospitals. Yes. Now, let's talk about something. Today we are going through random topics of prescription medication. We have talked about over-the-counter. Now the important part is this medicine that have prescription. Before we continue, let me say about how safe prescription medicine should be. How safe should be the prescription medicine? We are taking it in Benjamin, so we can't, because we have to know. Uncle, yes, thank you so much. Is it right for the patient to tell the doctor what medication they want? It's not right. It's not right. But to be advised is right. As a doctor, to be advised by the patient, you know, if I take this medication, I usually feel these adverse effects. To advise is okay, but to tell the doctor the particular medicine that you want is a problem. You know, in prescription medicine, a problem that occurs is, if a problem comes up with the patient, who will have a problem? Who will have a problem? If you tell this is a prescription medicine, and then you tell the doctor I want this medicine, but because the doctor and you are friends, the doctor gives, and then you go home, the medicine brings problems. Who will be held responsible? Is it the patient or is it the doctor? You see these things, how they come through. The person who will be held responsible is not the patient. If you are bringing social issues and friendship around professional grounds, and then you give your friend that medication, you know. Now this topic that we are talking about is important, Margie, you know the weight of medication. The medication can kill. Medication can make you permanently bad. antibiotics that people misuse. And you see, at times when I wake up in the morning, I go to work and I tell God always, God, please protect my profession and keep me online. Whatever that I don't need to do, guide me not to do it. The way I talk to everyone, guide me on how I'm talking to my patient and guide me on the interaction on the patient. Because you never know. You are trained, because out of good heart you are doing some things, you find yourself in problem. So let's talk about safe use of prescription medicine. How safe can we use prescription medicine? Take medicine exactly as prescribed. Prescription medicine is taken exactly as prescribed. And in which course? In this course, if you are told 500 milligram is one tablet, 500 milligram is one tablet, take it in the morning and in the evening. Make sure it is 7 and 6 in the evening. Take it as that way. Now, because you forgot the medicine in the morning, you want to take 1 gram in the evening. Calculated dose according to your weight and liver function cannot handle 1 gram. And then you start having yellowness of the eyes, fatigue, you are rushed to a hospital, you start blaming the doctor of a bad handwriting. You start blaming the doctor of a bad handwriting. And blame the doctor, and you are told, well, take 1 in the morning, 1 in the evening. Smiler is saying, how long should a doctor spend with one patient? Hey, Smiler, as much as the patient is satisfied, and has approved to the doctor that, doctor, I need that treatment. We don't have time. Talk to the patient, tell the patient because you are feeling, and that is what I do. If I've ever treated any patient in my life, ask that patient. They'll tell you that is a doctor that has no speed. Nabwete, greetings cousins. That is a doctor that has no speed in treating a patient. He talks so slowly and explains things so slowly. So tell the patient, I don't think that works in UK. Smiler, this is how it's supposed to be. Because you are feeling flu, you have fatigue, you are feeling headache, and as a doctor, I feel that you are suffering from this one, anemia. And anemia can be brought, I'm giving an example, is brought by this and this, and the kidney injury can bring anemia because this hormone erythropoietin, if it is not produced good, you'll get anemia. So you understand that? So this is not my diagnosis, it is an impression. Then I will take your blood, do a full hemogram and and kidney function to confirm my impression. And then if they come out as I think, I'll give you treatment according to. So when the results come, you tell the patient, you see, you have 5 milligrams of HB. Yes, you see in your full hemogram, I can see you have some kind of infection because lymphocytes are elevated. But you see, that is the right course that we go on and ask the patient, are you satisfied? Do you have any question to the doctor? That question that you have, take time, ask. So that when the patient goes to get the medication, the patient knows the diagnosis. You have worked with this patient from the symptoms. You have explained to them what is causing this. And then approval of treatment is by the patient. Will you take the drugs? Yes. Will you need injection? Yes, I need, doctor. I want to get better. Sign here. The patient signs them, and then you treat. the mental health of that patient plus the understanding is good. Healing starts from here. So don't hurry unless it's an emergency that this one needs the doctor to do it without being questioned. There's an example, emergencies that you do things without being questioned because you are saving life. But when a patient is oriented to place, time, speech, for example, if I visited the doctor for headache and then said that issue with my leg, I have to make another appointment. Ask that doctor, please explain this issue, my doctor. And if there is a problem that needs to be taken care of, let the doctor explain why they had the appointment. If you are not satisfied, go to the next opinion. Doctors are many, so don't worry yourself. And finding the second opinion is not bad. Even me, if someone goes to find the second opinion after I've treated, I feel good because maybe I did pick something. But most of the people that go and find second opinion and I've treated them, they usually come back or they come and say, you are right. Now, let's get on. Proper use of prescription medicine. And we have started talking. We have just started, my people. We have started. So, you don't worry yourself. If you have any question, you are new to the channel, ask these guys of mine. Act with my people. We have Smile in the City right from the Queensland, UK. Here has a channel. Nabwete Julie, welcome to the channel. Majay always supporting us. Majay be blessed from Jamaica. And Jamaican uncle, always from Jamaica, but right about now in the US. Big up and be blessed. Yes, everyone. Pancha was that here. Pancha has introduced me to an Indian community, and Pancha is teaching me how to speak Indian language, and I like that. Pancha. Pancha is a good person. Most patients are using AI before going to the doctor. Man, please continue using AI, and you'll find yourself in ICU. General things get on AI, but go and see a doctor. It's not something that has not been tried. When things come up, they have to be tried. Mostly when it matters health. We take the AI apps, we try and gauge them with the principle of medicine. You'll find so many gaps. So proper use of AI is good. It's making things easy. But you cannot give an AI study. Someone who went to school for 7 years, advanced as a consultant for 5 years or 6 years. How many years are those? 13 years to 15 years. And then you want to make an AI shortcut to your diagnosis. My friend, you will find yourself in ICU and you will not have a good time. Yes? Now, take the medicine exactly as prescribed. I totally agree with you, Dr. Benjamin. It is true. It's not some things that we have not tried. Even as medical practitioners, we come around and we try those AIs. But they are not. If you are trained for all those years, you will not give the proper management to a person. My people, are you getting me here? Now we are at a very particular, this is the particular topic that is very interesting and very good because it entails the social life, social interaction between a doctor, quacks, and the patient. The medical fraternity is suffering from the prescription medication. The medical fraternity, because let me say, you as a patient, you have gone to a quack, you have been given several medications that are not working. You come to a doctor who is qualified, What next will this doctor do? This doctor will start dealing with adverse effects of the drugs that are not right. I'm busy in the background, Myla. Sorry for late Ripper, and I'm good. Hope you are fine. Now, wait a big up. And then after dealing with those adverse effects, the next thing he'll start treating you now, reversing the drugs and treating you now. You see. So let's not think there are some things people say. If you go to that doctor always has no time and always want money. That doctor always gives you time, but it's very expensive. Medical issues are not cheap. If you find a doctor who takes time to be with you, explains to you, and then gives you the right medication, go to that doctor. Don't go to that doctor that has a very large line, no time with others, and is not very affordable. He is affordable. People say that one is affordable. You will end up going there several times and you will find that that person is not affordable. Cheap is expensive. Cheap is expensive. You get that? Cheap is very expensive. So all the guys that are here and you are listening, today I'm not hitting on something. I'm advising people safe use of prescription medicine. Check whether it should be taken with food or empty stomach or water. There are some drugs that can be metabolized when you take with water, others with food, others with proteins. Do not use someone's prescription because you had some symptoms that someone was suffering, and then you think it is better you use someone's prescription. How do you see that? How do you feel about that? Don't use someone's prescription. Complete an antibiotic course. If you develop serious or complete an antibiotic course when prescribed, unless the professional tells you otherwise. Because if you don't, you are a person who never completes antibiotic courses. What will you do? Offer resistance to your body. You'll be taking antibiotics that are not working. Today is an overview. We'll talk about all these things. Do not share your medication with another person. Never share your meds with another person. You have a dosage, give yourself a dosage. If a person has a problem, let that person go be diagnosed and started on a dose that is his or hers. Seek medical attention if you develop serious and unexpected issues from the drugs. It may not be from the drugs, it may be another issue that is coming up. So, my people, today is an overview. As we talk, hope someone will be asking a question. Yes, some people say today doctor is so hard on us. I'm busy in the background. Yes, sir. If you have a question now, ask, because from tomorrow, not even tomorrow, the weekend is so packed, my friends. We may not have some talks, but I may be having some round on live from Friday. But let's see how it will go. Prescription medicine are drugs that require authorization from 20 points. I want to read these 20 points. They are required authorization from healthcare profession before they are supplied or used. They are usually prescribed after a proper diagnosis of a patient. Not eye diagnosis. I think you are suffering from diarrhea because you have malaria, or you are suffering from this and that, and then you go over the counter and you demand to be sold. I know I have malaria. Give me that medication. Can't you see I'm having pneumonia? Why can't you give me antibiotic? Do you know if it is a viral antibiotic, pneumonia, even if you have the pneumonia? Do you know if it is fungal, viral, organophosphate poisoning, or bacterial pneumonia? Yes? Let's talk, my people. This is just an overview. They are usually prescribed of a proper diagnosis of a patient. And that's why they are called prescription medicine. Lots of black people are told they are borderline diabetic and doctors want to put them on metformin medication if it is because they get more money. I will not talk about that at Smile in the City. You know, I'm a doctor and you have the same people who may be doctors who are put on that. What we will do, we will talk about, as we finish this topic, we'll talk about how to give medication according to diagnosis, and you will learn about it. Yes. The healthcare professional determines appropriate dosage for the patient. Prescription medicine may require consideration of patient's age, weight, and general health, including the liver and the kidney. They are used to treat conditions that may require medical supervision follow-up, not just being given medication. Some medicine can interact with other medicine and food and supplements, and that's why they are called prescription. Before you are given, you are asked if you have any other problem and any other medications you are on. You see, some medicine can interact with other medicine. That is a very important, because interaction can make that medicine not work, or interaction can make that medicine to be sick, depending on which medicine you've been given. Patients should not share their prescription medicine. That one I've said. Patients should not use other person's prescription even if they have similar symptoms. It may be symptoms are shared with problems. You may be hypertensive with infection and you are diabetic with infection, and the symptoms are the same. So you don't take anti-diabetic, you take an antihypertensive according to the problem you have. Some prescription medicine require regular monitoring. Some prescription medicine can cause dependency or addiction. We don't want people who are addicted to some prescription medicine. Don't be addicted, my friends. Addiction is a bad thing, especially when it comes to painkillers, analgesics. We call them analgesics in hospital. You don't be addicted. Addiction is not a good thing. Addiction is not a good thing. Now, let's continue. Anyone who has a question, please ask. Someone who feels that today, doc, you are so loud. Today, doctor, you are so loud. Stop it. Talk to us so calmly. Yeah, I'm talking like that because of the frustrations that we undergo in hospitals. Sometimes you get frustrations in hospitals. Real frustrations. Someone has come in the hospital with 3 different antibiotics given from the same person. The first thing you understand that this person was not given by a doctor. Who gave you these drugs? Who gave you these drugs? Hey, I know he works or she works in a hospital somewhere. Are you sure? Yes. If you find out, the signature from the rubber stamp, you find out that, it was from somewhere hidden. So we will talk this week on, we have just started, today is on Wednesday, we will continue with this topic slowly by slowly, and we will interact with this topic until we get to the point that we have sensitized people about antibiotics and the best way to use the antibiotics. The best way to use the antibiotics. Now, I'm just about to finish some 1, 2, 3 things I want to say. Prescription medication should be obtained from a licensed and reliable pharmacy or healthcare provider to ensure their quality and safety. Not anyone. Licensed, a person who is trained and given the license to prescribe. The doctor prescribes, and when you go to a pharmacy, the pharmacist tells you how to take them. This pharmacist is trained and knows the drug. So he'll tell you according to the, medicine should be stored according to manufacturer's instructions and kept away from. Yes, as I come, my people, if you have a question, let me relieve myself a bit, just a bit. I come. If you have a question, put it down, and then we do what? We talk. So you see, my guys, I'm here back. Let's continue. Who has not liked the chat? Any question from anyone is appreciated. Any question from anyone is appreciated as we talk of prescription drugs. As we talk of prescription drugs, it's very important we talk about prescription drugs and the right way to take them. So we will discuss this over a week plus, because prescription drugs are so many. Prescription drugs are so many, and as we talk about them, you will understand that these drugs are important drugs that can help you if you just take them according to the way they are supposed to be taken. But when you misuse them, you will have a problem. You will have a problem. So anyone with any question of importance, question of importance. You see, we started talking about some things about mental health, and we have said that we will be having on Sunday. Sunday we will be talking we will be talking on Jamaican's Uncle channel about what SPL. All of you night dinner. Okay, we'll be talking about something that is important, that is called mental health of YouTubers, of growing YouTubers, mental health of coming YouTubers that are coming up. YouTubers that are coming up. Some prescriptions, patients should take prescription medicine exactly as instructed. So 3 minutes to go, 3 minutes to dinner special. Oh, nice one, dinner special. Anyone who has a question? Anyone who has a question? Anyone who has a question? You can ask any question before we finish, because some things are so important. You see, like what I'm saying, like some prescription medicine can cause dependence. Dependence on prescription medicine is a bad thing. You see, desert channel. How is the desert doing? They are used to treat conditions that may require medical supervision. Autism, depression, cancers, severe bacterial infection, like what is called septicemias, meningitis. Greetings, doctor. Greetings to you too, big man. Desert channel. You see, patients' information and care about allergies should be taken care of. That's why they are called prescription medicine. Prescription medicine. They are very important type of medicine that we should take care of. It's very important. Anand is in the house. Anand, welcome. Today we are talking about medicine of prescription. You see, Anand is from India and is a big supporter of mine since he started the channel. And I thank you for being an important person. Connect to Anand, everyone. Nadi, your knowledge, not understanding. I am Tamil. Oh, okay. Someone help Nathini to use a translator. Someone help Nathini to use a translator. Translator will help her to understand English. I think she's saying, all of you, my channel invite, I think she's saying that she doesn't understand English, but she can use a translator. Anand is saying, like done. Thank you, Anand, for your like, and also coming through to my channel always, and coming to my channel always. Big up and big time. It's very important for your support. So let me read the points as we go on to finish. Prescription medicine are given by authorized personnel only. authorized personnel only. They are not just given randomly. Okay, the other one is they are usually prescribed after proper diagnosis. Super comment super live. Big up to you, Anand. Thank you so much. The healthcare profession determines the appropriate dosage that you have, and I've gone and said because of the liver distribution and the dosage. You can use a lot of antibiotics on someone. It's a wrong antibiotic. It will not kill that bacteria. So you may be just damaging your liver and kidney. Some prescription medicine can cause serious side effects if used incorrectly. You see that? Yes? Patients should take care of prescription medicine exactly as instructed, how they are supposed to take the medicine. Patients should not share their prescription medicine with other people. If you feel that you have a symptom like the other person, don't try to share your prescription with that person. Stick to your prescription. You see, stick to your prescription. Stick to your prescription. Yes, antibiotics should not be used when appropriately prescribed, because inappropriate use is antimicrobial resistance. Let me repeat about resistance. Antibiotics should not only be used when appropriately prescribed, and when you just feel chacharas in the house, a big up chacharas. When you feel that you are better, you stop using the antibiotic, finish the dosage. You know, the bacteria may learn, when you kill a bacteria partially, it may learn how to fight with that bacteria, to that drug. And then they become bad than ever before. Krishna Bharda from India. I'm doing good, chacharas. Today we're talking about antibiotic and resistance. Patients should inform healthcare professionals about what allergies they have and what they are undergoing. Antibiotics should only be used when appropriately prescribed. Yeah, Krishna, welcome to the channel. Hit the like button and tell people we are talking about medicines that are supposed to be prescribed. Prescription medicine. They are called prescription medicine. Yeah? If you are what causes allergy? Allergies are caused by the proteins of your body. When you take a drug and one protein does not go around well with it, you start having histamine release. Those are allergies. Yeah? See, so if you are coming in today and you're watching the doctor, my name is Dr. Ben from Kenya, outer Nairobi. I like coming online and sensitizing people about medical tips. That is what I usually do. In India, it is night now. Oh, Krishna, it is night. Okay, what time is it in India right now? Here it is 30. It is 6:30 p.m. right here. Here it is 6:30 p.m. Some prescription medicine may be unsafe during pregnancy or breastfeeding. Oh, 9 p.m. So you are ahead of us by how many hours? 6, 7, 8, 9. 3 hours ahead of us. 2.5 hours ahead of us. So patients should take prescription exactly as prescribed. Exactly as prescribed. And the storage of the medicine should be which medicine can I use? Which medicine can I use? Chacharas, send me an email or text me on my WhatsApp. We explain. I'll ask you some questions and I'll give you some. Where are you from? I'm from Kenya, Africa. Kenya, Africa. Kenya is known worldwide. Kenya is known everywhere. Nowadays, we are being sold medicine with unauthorized personnel wearing white coats. Yes, because this person was working and cleaning the hospital, and he knew some products and how they are given. So he goes to the village and starts a chemist or a pharmacy. But I thank God in Kenya right now, if you do that, my friend in Kenya, if you try to do that, I want to come to South Africa. No worries, Krishna. No worries. If you try and do that in Kenya, jail is waiting for you. Some medicine can interact with other medicine, that is very correct, they can interact. Some prescription medicine may be unsafe during pregnancy, it's very correct, unsafe during pregnancy. Yeah? So let's get to know who has any question today in this evening. Who has any question? Who has any question? Who is having any question? Or who can add something? Don't just listen to a doctor. Sometimes say something. I want to meet South African cricketer Adin McCree. Oh, okay. I don't know South Africa well. I'm in Kenya. I'm in Africa, Kenya. South Africa is another state. So I've not known South Africa so well. But right now, South Africa, there are going issues. Traveling to South Africa now, I don't know if it is safe. Is it safe traveling to South Africa right now, guys? Has it been safe? Yes. Just don't listen. Now, some 2-3 questions as we finish this topic of highlighting on our prescription medication. You are from East Africa. From East Africa. Google Kenya. Kenya, you'll see it, the eastern part of Africa, East Africa. You are from north. I'm from East Africa. Today I was just giving an overview of this prescription medication. This topic is so deep and you'll see it. So we'll talk about prescription medication one by one, antibiotics, antihypertensives, all those slowly by slowly, so that we understand why we give this one and why we don't give this. Why we tell you take this drug and don't take milk. Why we tell you only take this drug with water and not tea. You know, those are things that we will be dealing with on this topic that is coming, slowly by slowly. And just to note that on weekend, very many occasions will be there, so we may not come on. So the next topic we can do is tomorrow, but the weekend I'll be bringing you some things live from some occasions. So stay tuned, and tell people that Doctor this weekend has some good things that are coming on his channel, and we will feel good. So feel good evening will be in another level. So wait, you'll see. Feel good evening will be on another level. Anyone with a question before I leave, my friends? It is 1.5 hours going to 2 hours. Anyone with any question? You ask. I'm waiting for questions. I'm waiting for any question. I can't live without being asked a question. Hey, my guys. Yeah, you just let the doctor go without asking any good question. Don't let the doctor go without asking any question. So let me big up Krishna Bada. Let me big up Krishna Bada. Let me big up Krishna, Panchanathan. Let me big up all these guys of mine. The people that are here supporting. Michael Len, Jamaican Uncle, Smiler in the Sydney, Chacharaz. Chacharaz is from Nyabohanze. Chacharaz, are you from the village or where? Or Nairobi or Nyabohanze? You know, nowadays I get so many people. Chacharaz, welcome. Big up yourself. Anand from India. Ananda, big up yourself for your support. Thank you so much. Natini said, your knowledge not understand. I am Tamil. Your knowledge I don't understand. I think I'll help you to use a translator. Okay, let me go to Smile in the City. Nabwete Judith, big up, saying she's in the background watching and listening. Maje D, thank you so much for always being here. Thank you so much for always being around, Maje. Nice one. There is Marcia, big up every time. Marcia, big up every time. Smiler in the city, Jamaican uncle, Marcia Thompson, all Jamaicans, big up every time. Ravi, thank you so much for being here always. And this friend of mine here called Reha. Nice one. Nice one. Stan's Kitchen, Pantanatha, Stan's Kitchen, always. The best teacher 07, big up yourself, and everyone that has come to my channel to watch. You know, these things, when we sensitize and we give people knowledge, is that to make people understand the necessity of taking good care of your health. You see, sensitization is very important. Just to talk, and this is how we are supposed to live. You know, this is how we are supposed to live. So everyone who's been watching and supporting, share this live. Everyone who's been watching and supporting, if you have not shared, share it to a friend of yours that you know. And you see, YouTube now is bringing more commitments, saying you cannot earn, just sit there and earn. You have to work, give us content to push out there and get more clients. That's why YouTube is saying 8,000 watch hours, 1,000 watch hours for those that are monetized. So for you who is monetized, you'll need to have at least 1,000 watch hours. If you delay working on your watch hours, you'll be demonetized. You'll be demonetized. You see, very important. 8,000 watch hours is not a game. It's not a real game. You get. So my people, my guys that have come in, my request is you just share my lives. I come on lives and we share and we continue growing and growing. So bye my friends. I know there are no questions you could have asked long time ago. So you guys have a nice evening. Have a nice time. We will talk again tomorrow or at night. Big up yourself. Bye. See you guys.